My name is Aaron Lee. I'm a recent graduate from the Masters of Public Health program here at USC. My concentration is in epidemiology and biostatistics. During my undergraduate studies, I was a part of two nonprofit organizations called Big Brothers Big Sisters and Make-A-Wish. And during Big Brothers Big Sisters, that experience really allowed me to experience public health within a mentorship perspective. And it really motivated me and made me more passionate about being in public health and pursuing a master's in public health later down the line at USC. In Big Brothers Big Sisters, I was a part of the mentorship program where a mentee and mentor would both participate in a mentorship program, and I would soon find out that most mentees become mentors at a later part of the program during their high school years, and I found that piece to be extraordinarily beautiful and wonderful to hear. It allowed me to gain insights in public health through a community lens, and it really motivated me to then pursue an MPH here at USC with the intent of helping at-risk populations through an epidemiological and biostatistical lens. I chose to study here at USC because of the excellent networking opportunities provided by faculty, staff, and researchers, as well as the excellent research opportunities such as the Klausner's Research Group. I'm currently interning at the Klausner Research Group, where I'm working on a literature review investigating HPV testing in the United States, and where I'm understanding the rates and what the current barriers are in research for, I guess, any and all groups within the United States. On the other hand, I'm also a part of the evaluation and improvement team in the Southern California Clinical and Translational Science Institute here at USC, where I'm helping several different groups or several different departments with their IRB submission forms, helping them understand the process in order to gain access to further develop their studies. And so with this knowledge, I'm hoping to strengthen my understanding in clinical research. I'm the proud recipient of the TSAF Scholarship here at USC within the Department of Population Public Health Sciences, and TSAF stands for the Trojan Scholars for Advancement in Public Health, where the ideas of diversity, equity, and inclusion are ingrained in the program. This program, or the TSAF program, allows students to gain a better understanding of DEI within a public health setting. At the beginning of my public health career here at USC, I joined a student organization called Masters of Public Health Student Association, or MAFSA for short, where I first served as Director of Student Relations, and then a year later, I ran for the president of MAFSA and was incredibly honored to have been serving as MAFSA president ever since. Our association promotes students' needs academically, professionally, and socially within USC's MPH program. Being a part of MAFSA offers students a variety of resources through connecting with other peers or students within the program, being a part of our community engagement activities such as food drives, as well as water drives, as well as being a part of any social activities such as our annual tailgate that we host every year. One piece of advice I would give to students considering an MPH here at USC is to really take your time to navigate this program. This program is so big, and also the time goes by very quickly. And I definitely would recommend connecting with as many professors as you possibly can, just because they would write you letters of recommendations and also provide you with any opportunities that you might ask for or want within your time here at USC. Definitely would take the time to get to know your professors and just ask questions, be curious. I want to give a huge shout out to Dr. Coburn for teaching me about epidemiology and the importance of epidemiology within the greater Los Angeles area and in Australia. And he really taught me a lot about epi and really gave me the ropes to pursue this concentration in its capacity. I also want to give a huge shout out to Dr. Chowdhury for teaching me SAS and being my professor for PM 511A, which is a difficult course, but she really was patient with me and allowed me to understand data analysis to a whole new different level. And I really appreciate my time with her in that class. I also want to give a huge shout out to Dr. Kareem for being my current professor for infectious disease epidemiology and being a fantastic mentor to me, both as a student and as a potential future peer. She allowed me to understand infectious diseases to a whole new degree and is very extremely open to change as well. One thing I'll miss about being on campus are definitely the activities that occur within both campuses. So in February, there was a Dragon Dance Festival in celebration of Chinese New Year, where it was really interactive and also very fun and engaging with not just the MPH students, but also the MDs, the PharmDs, and also any other students that resided within HSC at the time. But another fun activity, I would say, are the farmer markets, where it occurs every Tuesday, and there's fresh fruit and fresh food there for everyone to purchase and support local businesses. One thing that I'm proud of during my time here at USC is being able to call myself a USC alumni. I've always wanted to be at USC, whether it's through undergrad or whether it's through grad school. I'm very proud of my achievements here. I believe that I've achieved all that I could here at USC, and I can't wait for what the future holds for me. After I graduate from this MPH program, I hope to take a gap year and apply to prospective PhD programs to further develop my research skills in epidemiology.